can't live without.
Perfect.
Announcing the Lazy Days of Summer Sale. For a limited time, get 25% off everything, plus an extra 5% off. Plus, you'll receive 12 months special financing on your purchase. So don't wait, hurry in now. Lazy Boy Furniture Galleries. Live life comfortably.
Zaxby's Chicken Finger Plate comes with 12 dippable, dunkable, do-it-any-way-you-wantable sauces. And a plate of our hand-breaded fingers. Oh, and don't forget the napkins. Famous fried chicken, endless sauceabilities. Only at Zaxby's.
For a while on 3+U, we had the great pleasure of having members of the Hamilton County Health Department pay us a visit on the show. Somehow or other, those visits kind of slipped away for a while, but we're so happy to have them back on the show because the truth is there are so many things going on, so many layers at the Hamilton County Health Department. This morning, we'll focus on one of those. Renee Craig is here with her Ezekiel Garcia, and together they are going to talk about the outreach program. Good to see you.
Good morning.
Kind of a new program about to turn 1 in September.
It is. The community outreach program came about during the COVID-19 pandemic and our response to getting vaccine out in the community. And we discovered that there were sort of vulnerable communities that had difficulty coming to us to receive the vaccine. Mm-hmm. And so we started doing some Hispanic outreach and working with African American churches to go directly into the neighborhoods.
Right.
And so we've now taken that model and we're doing 2 to 3, sometimes even 4 events a week directly in the community.
So as a result of that, Ezekiel, you're kind of on a pedestal, I think, in their eyes because you went right into the Hispanic community here in town, and now you're seeing this, I think you said, the highest vaccination rate of any of the populations. Is that right?
That is correct. We are at 64% of the Hispanic community is vaccinated in Chattanooga. So we're so happy to have that in our community. It all started in 2020 when we were meeting with pastors, local faith leaders. We partnered with Mr. Jose Luis Loa. He's the owner of the Loa grocery store. We would set up vaccination events at his locations, and we were able to have one-on-one conversations with individuals who were hesitant. The language barrier was a big issue, and so we were able to address that. At all of our locations, we always have interpreters or bilingual staff to be able to address their concerns and help them throughout this whole process.
So, I mean, certainly 64% is a great rate.
Yes.
And really and truly, you take what you can get,
yes.
right? So that's essentially 2/3.
Yes.
We might not ever see 100% vaccination rates. A lot of people still have some questions and concerns.
Okay.
But going into the school year,
right.
Are you kind of hoping for an easier transition because maybe that herd immunity will kind of be out there a little bit?
Well, our main focus is that if someone wants a vaccine, we want to make it as easy and convenient as possible for them to receive it.
Okay.
And so that's why we are going deep into the community. We will literally go into apartment complexes and set up sites in their...
You go to them?
We go to them. And currently the CDC back in the late spring came out recommending that those of us over age 50 receive a second booster shot. Mm-hmm. So we've been focusing a lot on that over the last few months, going into the senior living facilities. A lot of them have mobility issues, mm-hmm. transportation issues, and so we are there. They literally come downstairs as they would any other day, right. And we're there for them.
So is some of this, I mean, I'm sure, Ezekiel, as you were getting out into the community and really face to face with people, there was a lot of trust that you were looking to build. Is that a key component here?
Yes, and the fact that we were set up at these grocery stores, it's where people go every week to get their groceries, and now we were there. At the start of all of this, we had information tables simply to provide information, be able to offer them an appointment when we were doing the appointment system. And so that has helped us even now. They'll come just to stop by, ask questions, something has happen in their family, and they'll ask more questions about the vaccine or about the illness. And so again, being there constantly every month has helped us to build that relationship with them.
So that is what you're doing monthly, their monthly visits, so that people can kind of know how to put it on their calendar?
We've been going monthly to LOA.
Okay.
There's other locations that we go once, and then we get, anyone who wants to be vaccinated. Certainly if they call us and say, hey, it's time for boosters, can you all come back?
Right.
We go back.
Oh, nice.
Yes, so, and we work with such a large variety. Originally it started out with the Hispanic outreach, but now we're doing an event Monday at the YMCA at Hamilton Place. This will be our third time going back there.
Wow.
We're seeing great numbers there.
Well, and I would imagine when you are going out like this, people are saying to you, I'm so glad to find out all that the health department encompasses.
Right.
It's not just going to get your birth certificate.
It's not, and we answer all those questions too. And then of course we still have our health department hotline that they can call to see about all of our other services as well. And but yeah, we'll give out test kits while we're there, and sometimes that brings people in so that they feel comfortable asking us questions.
Right.
And then we've certainly referred people to our WIC services in the past, family planning.
So this is really just a door opener for people for all the other services that you do provide.
Absolutely, and we encourage people, even if they're not coming to get a vaccine, just come talk to us and ask us questions.
Yeah, to that point, Ezekiel, when you're talking to people, and you don't have to reveal anything that you shouldn't say, but do you find that folks still have a lot of questions?
They do. They'll ask if they're ready for their second booster. They'll ask questions, when is the next booster coming out? For those who are under 50 and haven't been able to receive it. So they're asking all of these questions. And if we're going to travel, how do I go about that? Where do I get tested? So where do I get a PCR test? So we're able to provide that information to them at those locations.
Okay, I'm going to set you up in that way you can get in your car and go, I can't believe she asked me on TV. But do you ever hear people say to you, either one of you, I guess, that is it really important to get the booster because it seems like there's still so many widespread cases of COVID? Do people ask questions like that to you too?
Yes, all the time.
Okay.
Yes, they want to know, when they see, especially when they're in these, we're in these senior living facilities, and they're seeing all of their, the residents from the community getting their vaccine, and they're like, well, do I really need this second booster? And so we follow the CDC guidelines on that type of thing, and that's the information that we provide to them. Is right now, currently the CDC is recommending this level of vaccine for your age group.
I'm so glad that that's the answer you gave, because the truth is we don't hear about COVID as much as we used to. It's not a daily part of the conversation. So you forget that those CDC guidelines can change. Somebody has to be up to date on what the change is, and that's y'all.
Exactly, and that's the beauty that we have now been at this for a year, and anytime there is a change, we can adapt so quickly, and it's a matter of us getting the vaccine in our hands in the proper forms, and we can be out in the community within minutes.
Okay, so real quickly, if anyone's watching and they want to learn more, obviously they can just go to the health department's website.
Yes.
But do they schedule any of these appointments for you to come to them?
No, all of our community-wide outreach events are just walk up.
Okay.
So we will be in a tent in the parking lot or in a community center. No appointment necessary. Our hours are on our website.
Okay. And where will you be next, Ezekiel?
We will be on Monday at Hamilton, the YMCA at Hamilton near Gun Barrel.
Okay.
So we'll be there on Monday from 10 a.m. to 1 p.m.
And is that targeted also at the Hispanic community?
That's open to everybody. So if you're driving by and you see us, you're more than welcome to stop by.
Would it be beneficial for you to say that in Spanish for those who don't speak English?
Sure. Si gustarían recibir su vacuna, este lunes estaremos en el YMCA de Hamilton, que está ubicado en Gun Barrel, de las 10 a 1 de la tarde.
Excellent. Thank you.
Thank you.
So here's again the contact information for the Hamilton County Health Department. They do so much there. health.hamiltontn.org. Their phone number 209-8249, 10 a.m. at the Hamilton Y on Monday. Thank you both.
Save big at Ashley's 2 biggest days to save. Friday and Saturday only. Save 25%.